Yeah. No. Remember, you're not right on these. You guys will turn them back in. All you need is your name, and that's it.
Name and the date.
On the date. You didn't want to test me today, huh?
He's
What's
testing
my
your
name
patience.
again?
What happened?
What's my name again?
Joshua. Nicole. June.
Who's Amanda?
I'm looking for it. All right. I think the first one is endotracheal tube. Is that right?
Yes.
Okay. So first thing, like any other skill, you start with BSI scene safety. Okay. BSI scene safety with any skill. Whenever you're starting any skill, make sure you say it. Okay. Even if you jump from one for another, BSI, jump to another, BSI. Always. Again, if you start it any other way, it'll be an automatic fail. Okay. So, a couple things to know. Like I said, you guys will not be intubating anybody, okay? You guys will not be intubating anybody. Now, there's a ID. So, if you guys see this one says 7.5, it's the ID, it's the size, okay, of the tubing, and there's different sizes. Now, how you determine the size, number one, is you simply ask the medic, because the medic will be the one telling you, give me a 7.5, give me an 8, give me a 9, whatever the case may be. Okay? They're the ones that are going to tell you. All you need to do is just grab the right size. If you notice here, it has another little cord, little tubing that goes off to the side. This is to actually inflate. Okay? This goes into a little bar right here that's going to actually open up the airway. This goes all the way in. It opens up the airway and allows you to suction, to breathe. There's an attachment that goes onto the BVM here, and you can breathe for them. Okay, so that's what it is. Okay. Okay, tongue depressor is a heavy duty tongue depressor because sometimes they have lockjaw or anything like that. So you put it in and you push it down. Under this battery's dead here, but normally they have a light. When you guys do it, you guys can see it. I don't know, back there you guys can see this right here where my finger's at. Okay. That's usually what the light so everybody can see. And then we have the soft tip suction catheter. Okay, this is what you guys are actually going to use to suction. Okay, so again, and this is what's going to turn it on and off. Remember, this is going to be attached. This part right here is going to be attached to the actual suction device. Okay. Now, again, BSI scene safety. First thing you're going to do is either you're going to come on scene and the medic already is doing this right here. Okay, or the medic hasn't done anything at all, or the medic has this going on right here. Okay, where they're intubated already. Either or. We're going to go over all the steps so you guys know what to do and how to do it. Okay? Excuse me. So, number one, BSI scene safety. We're going to pretend like the medic hasn't done anything at all. You're going to go ahead and say, okay, medic, what size do you need? Okay, it's going to tell you, in this case, we'll say a 7.5. These are all sterile, so these are going to be two separate packages. This is called the French tip catheter, okay, or a soft tip catheter. It's going to be 1 and 1. So, first thing you're going to do is you're going to grab the right size, whichever one the medic says, and then you're gonna measure from tip to tip. Okay, just exactly what that means, from one tip to the other tip. Okay, just like that. Okay. Once you do that, you're gonna measure, and you're gonna either put your finger there, or somehow you're gonna keep marking that. I usually fold it in half, and I do it just like that. Okay, and this allows me to put my thumb, okay, over the basically on and off button. Okay, because the suction is going to be on, and again, how suctioning works is going to go for the first hole. Okay, so right now it's just suctioning through here. The minute I block this, it's going to start suctioning from down here, which is what we're going to do. I'm going to hand this off to the medic. So here you go. The medic's going to go ahead and start the intubation process. Okay, lights on, go all the way in. Okay, so you're going to go, they're going to inflate. Okay, and we're going to go ahead and from wherever we measured, okay, we're going to go all the way in until we reach the point to where we measured, or until we meet resistance. Remember, usually that's going to be either vomit or something like that you might meet resistance in that case. And then in this case right here, okay, we'll say I measured it here, but I only got down to here. That's okay. I'm going to go ahead and suction. I'm going to weigh out in a circular motion. So to suction again, I'm just going to go ahead and block the hole right here. Now it's going to start suction from all the way down here. Circular motion over the 15 seconds. Okay, and then we're going to go ahead and ventilate. Remember, there's going to be an attachment to the BVM. Ventilate, 1, 2, and then if the medic says suction again, then we're going to go ahead and suction again. Okay, and it's going to be the same thing for the stoma minus the tongue depressor. Okay, it's going to be another attachment. It goes in through here, and we're going to go ahead and suction. Okay, it's going to be the same thing. Okay? Again, You guys will not be intubating anybody. All you're going to do is measure and suction and ventilate. That's all you guys are going to do. Okay, you guys will not intubate anybody. Questions?
So on the on this skills test, they're gonna just put that in there, the tongue depressor and the intubation too.
That's up to you guys. Because remember, when you guys are doing the skills, it's up to you. We're gonna have everything spread out right here, and you want to say it just how I said it, then that's fine. If you want to say, we'll pretend like the medic already has the tongue depressor in, then that's fine too. Now, if you do have this situation where you guys have got there and the medic already has intubated the patient, you're gonna ask the medic, what size, okay, is the tubing? Okay, what size is the catheter? And they should be able to tell you, oh, it's 7.5 or whatever size it is. Then at that point, you're gonna go ahead and go back to your rig, grab the same size, and then you're gonna go ahead and measure with your French tip or your soft catheter. Same thing. You're gonna measure it, come back. Remember, your gloves are on, BSI, and then you're gonna go ahead and suction. Okay. So that's how you're gonna measure. You're not gonna tell them, oh, can you go ahead and take out the tubing or anything like that so I can measure it. Okay, you're not gonna do that. Plus, if you do, they're probably just gonna laugh at you. Okay? Questions?
How do you measure it again? Sorry.
Yeah, it's you're gonna measure. What you're measuring is the French tip or the soft tip catheter. Okay, and you're gonna measure from tip to tip. So you're gonna insert it all the way, and then once you see it there, pull it back, and you can put your finger there, tip to tip. Because remember, you guys have gloves on. Okay, so tip to tip. And it should be that long. Okay?
That'll be in the report already, right? Like we don't.
It depends on how you walk into the situation. Again, if the medic hasn't started anything, or say you're there first and all of a sudden the medic says, hey, we need 2 RCI, then we're going to go ahead and do this. Okay? And now, if you get there and the medic is already intubating, then you're simply going to ask the medic, what size is it? Okay? That's it. So it's up to you guys, as long as you guys say it, whether nothing has been done yet or medic is already intubated. I want to hear both. Okay.
How do they measure that one?
This right here?
Yeah.
Usually they'll measure it. So with medic, it's a little different. You know how we usually measure from tip of the ear to tip of the mouth. They do it a little different to where I can't really specifically tell you what it is. I don't take medic courses, but from what I've seen, my buddies that aren't, they'll kind of set it that way. So that's why we don't measure. We don't measure the actual catheter here. We just measure the soft catheter, and we suction and we ventilate. Okay, ventilating is an important part because remember, this whole time, what is the patient not being able to do? Breathe. So we need to breathe for them. Okay, so we need to ventilate. Okay.
Sizes go up to like 7.5 sizes.
Oh, the guy. I think the biggest one's like a 12. No, that's Francis. I think it's like a 10, something like that. Yeah. Forensic catheters, they go up to 14. Okay. Questions on that?
How do you demonstrate verbalized removal or replacement of O2 ventilation?
That's where you're just gonna say, I'm gonna go ahead and ventilate the patient. Because see this little tip over here? That'll attach to a BVM. So
Okay.
you just put it on, ventilate, and then take it off. Okay. Questions? No? Okay, which one's next? Oh, you have a question?
Oh, I just had a question. Are we doing this on the same day as all of our other skills?
No, we're doing this right now.
Are we doing it before lunch, after lunch?
Hopefully before lunch. Hopefully we can get it done before lunch. My proctors back there are gonna help me too. So hopefully. Right. Okay.
Wait, are you testing every single one of us?
Yep.
You have 22 minutes.
I'm aware of the time. Jess, did you have the glucometer?
Yeah. Did you take the dog?
Thank you. Okay. So when it comes to the glucometer, again, yes, I've seen safety. Okay, so this was an older one. There's different ones. Usually hospitals and pre-hospitals will have little small lancets. They're disposable. They're about that big, and you just tear off the front part, and you see the needle after you break the finger. Okay, and then we throw them away in the sharps container. If you have, like this one's one that has multiple ones, okay, and you kind of hear in the clicking. It has an interior rotation. It has different needles, and it will just kind of start zapping. This is for a personal use. Okay. Now, like I said, pre-hospital, we have the disposable ones. Okay, obviously for sanitary reasons. Okay. So, BSI scene safety. I'm gonna gather all my material. I want to make sure I have my glucometer, my lancet, my strips, which I don't have, Band-Aid, and alcohol prep. Okay, so I'm gonna go ahead and grab my patient's finger. I'm gonna go ahead and milk the finger. Okay, so this is what I mean, milk and get blood into it. I'm gonna go ahead and clean it with an alcohol pad. Okay, and I'm not gonna air dry. A lot of people they'll clean it and they'll do. What do you do?
Put bacteria
Just
on it.
contaminate it.
I
Yeah.
have a comment. I have license phlebotomy. It's not good to milk the finger because then you get all of like the stuff that's not blood. You should just let it sit and like get that's there.
Yeah.
Well,
Patient at my school is okay. You just like you're gonna wipe it off and then you
Yeah.
just take it and that's it.
well, we wipe. We don't ever take the first drop.
Yeah.
Yeah.
We take the second drop
But-
for that reason.
Okay.
Don't
Yeah,
leave
for
Then you're
that
talking
reason.
about milk. Okay.
Yeah, yeah.
I was like,
Yeah, for that reason. No, it's absolutely true. If you take the first one, you're gonna get an off reading. It has so much other stuff, so we don't take the first one. And
Because usually when I go and like have like my checkup, that's what they do. Like they always check like for like my blood sugar. So they do that. Like they milk it. They poke my finger and then they wipe it down and then take the second one.
yeah, so it's for that same reason. Because remember, there's waste, okay, in the body, so we don't ever take the first one. We take the second, or so I think you can say take the third. So second one is fine. Okay, so you'd be right. If you'd be right if I were to say I would take the first one, then absolutely I would be in the wrong. Okay. So we're gonna go. Where was I? Look the finger, wipe it with an alcohol pad. Okay, and then always tell the patient what you're gonna do. Okay, I don't know if they tell you what they're gonna do before they do it. Anytime I poke the finger. Oh, okay. Well, normally they do that. So once you do that, I'm gonna go ahead and take my lancet. Okay. Oh, I'm sorry. I take that back. Before I do my lancet, I'm gonna go ahead and make sure my strips are compatible with my glucometer. Okay. The newer ones, all you need to do is insert the strip the right way, and automatically it'll turn on. Okay. The older ones, you gotta hit the power button and then turn it on. And then put the strip in. Okay. Like I said, the newer ones, all you need to do is go ahead and insert it, and I'll check compatibility. If you insert it wrong or anything like that, you'll get like an error, like an E or an R, or it'll tell you it's wrong. Okay. Now you can either say, for the skills purposes, you can say I'm going to go ahead and turn on the glucometer and then check compatibility by inserting the strip, or you can just say I'm going to go ahead and insert the strip, and if I insert it correctly and if it's compatible, it'll turn on. Okay. Either or, it'll turn on and it won't give me an error message. Okay. Either one's fine. So once I do that, then I'm going to go ahead and take the lancet. I'm going to tell the patient they're going to feel a small prick. Okay, I'm going to go ahead and poke the finger. Okay, and then I'm going to go ahead and wipe off the first blood. I'm going to go ahead and take my glucometer with my strip. I'm going to collect the second strip of blood. And then once I collect it, I'm going to go ahead and set the glucometer down. I'm going to put a Band-Aid over the patient. I'm going to reassess the patient, make sure they don't pass out on me. Again, some people cannot see blood, so make sure they don't pass out on you. And then I'm just going to go ahead and read the glucometer and document it. Okay, and then dispose of the sharps container and anything that's blood or anything like that, and biohazard. That's it. Okay. Any questions?
There's just one question. Back to the milk and finger thing. When on my ride along, the medic had me do the glucometer on him, and I poked his finger, and it, like 15 seconds went by, and like no blood was showing. So then he had me kind of milk it. So what happens if like no blood's coming out? Would you then have to milk it or?
That's another reason why we try to milk it before, because when you poke it and then milk it, again you get all that waste and stuff like that, which you don't want to do.
Yeah.
So ideally you milk it before, and then you set it.
Got it.
Take it on.
And when you poke fingers, try and go for like the edge of the finger, not like the right end of it.
That was the size. So yeah.
You say you took the class, right? All right. What finger are you using? Why?
Because it's the thickest. You're gonna get the most blood out of this one. I know. That's what they told me. That's what I remember the most. They're these two, and then you go.
Do you know why? This finger?
Don't you? artery. that
Oh,
goes
it's
straight from
it's
your
the one
heart.
that goes up to your heart. Yeah.
Yeah. I knew that. That's why the ring finger thing.
What were you gonna say?
That's why it's your ring finger, because that's the
Connected to your.
Yeah, the ring is directly connected to your heart. I was told that when I was like 6. The ring finger-
It's corny, but it's true.
directly to your heart.
It's the truth. And
Wait to remember it.
Oh.
and if there's a court in LA, we'll do it. It's sounds speak, so I hope nobody gets offended. This is not me making stuff up. Okay, it's the least functional finger. Your ring finger. Yeah. It's the least functional finger. Yeah. So that's what they say. Oh, go for the ring finger. Yeah.
Yeah, you can do like a full extension almost.
So that's what they tell you to go for that one as well. Aside from the heart, it's the least functional. And so you can basically do without it. It's a theory. Again, not making it up. Look it up. Like, the whole course all about it.
I don't believe it.
I'm making it cold already. Alright guys, so any questions on that? No? What's the next one?
MDI assistance.
So, we'll say this is my MDI. Okay. So,
You okay?
what happened?
Pen sound.
Everybody alright?
Yeah. Just
Alright. We got nitro pills. What's nitro? Oh, you guys are recording, never mind.
Yeah, it already got awkward when you put your hand on his face and you started putting your fingers out. My last yeah.
Are you really doing that?
Yeah, you put your hand on his like you were talking and you put your hand down and you put your hand down again and then the last one like I just pictured a guy going
Go ahead and erase that for me.
I'll edit it later.
No, you won't. Okay, so again, BSI scene safety for MDI meter dose inhaler. Now, one thing you guys need to know about meter dose inhaler is that every time you depress it, it's gonna throw out the same amount of medication all the time. So meter dose inhaler does. Okay. Now, another thing you guys should know too is before it gets to that stage, you should have already done some sort of assessment for the patient, which means they should be on some sort of oxygen. Usually an NRB is usually what they're on. So that being said, you have to do a couple things. Number one, you have to let the patient know what's going on. Hey, I'm going to go ahead and take the mask off. I need you to take a deep breath. Or you can just say, take a deep breath out. And then on my count, I'm going to go ahead and put the NDI in between your lips. And on my count, we're going to go depress it. Once you do that, take a deep breath in. And hold it for as long as comfortably possible, okay? You're not going to tell them to hold it forever or anything like that, as long as they comfortably can. Because remember, they're already in some sort of pain. Okay, so as long as they can, and then you're going to tell them once you're ready to release it, you go ahead and release it with pursed lips. You want to know what pursed lips are? Okay, just like that. Pursed lips. Just like that. And then put the NRB back on. Okay? Don't forget that. A lot of people forget to put the NRB back on. Okay? If you guys forget to do that, then you're not really helping out the patient, and at that point, you could fail the whole skill. Okay? So, BSI team safety, I'm going to go ahead and attend to my patient. I'm going to let him or her know what's going on, what I'm going to do. Then I'm going to go ahead and grab the medication, and I'm going to check the medication. This is the most important part. Okay? I want to make sure it's not expired, make sure it belongs to the patient, it's the right medication. It hasn't been tampered or anything like that, like if this was broken or something like that, or it didn't have the cap, then obviously I wouldn't be able to use it or anything like that. Okay. Once I do that, I'm going to go ahead and shake. I think your skill says shake vigorously. Okay. Break up the molecules in there, shake that vigorously. I've already explained to my patient what I'm going to do. Now I'm going to say, okay, Mr. Ma'am or Sir or anything like that. We're going to go ahead and now do exactly what we discussed. Okay. So go ahead and remove the mask. Okay, let the patient exhale, put it between your lips, and on my 3, we're going to go ahead and depress it and administer medication. At the same time, patient is inhaling. Just okay. I'm going to tell them they're going to hold it for as long as possible. Exhale, pursed lips. Put the mask back on. Okay, and document how much, what medication, okay, and what time I've administered it. and reassess the patient. Okay, remember, we want to make sure that whatever we're doing, whatever kind of assessment or intervention we're doing, is actually helping the patient, and we want to document all of that. Okay. Any questions on that?
Is it just one dose?
Depending on what the medication is. For this skill, just one dose. Your question, Mom?
It's a combination of the short-acting beta agonist and the long-acting beta agonist. It'll say something other than albuterol, like Combivent. Can we do that, or does it have to only be albuterol?
No, it again, this doesn't really particular to, at least I don't think so. It's just the key thing for the skill is knowing how to do it when they're on NRB and stuff like that. Medication goes a different way. Okay, so here the whole purpose of this skill is to make sure you guys know how to do it using NDI. Okay. Good. Questions? Good. All right. What's next?
Auto injector.
Okay, auto injector. Again, we kind of already talked about it, but I'll review it really quick. Number one. Now this one, I know some of you guys might have something to say about this. This one, we're gonna expose the area. Okay. Again, this is an ideal situation that there is no religious preference or personal preference or anything like that. Okay. And you've caught it early enough where you don't hear any stridor or anything like that. Remember, stridor is a late sign of anaphylactic shock. Okay? So I'm going to go ahead and talk to the patient. I'm going to go ahead and grab my medication, and I'm going to make sure it's not expired, it's not damaged. This one doesn't have it, but the newer EpiPens have a little clear sight glass, it's called. So make sure it's the right color. You don't see any little floaties in there or anything like that. Has been compromised, expiration date. So you got to make sure everything checks out. Okay. Once you do that, you're going to go ahead and expose the area, okay, anterior lateral side of the thigh. You're going to expose it, you're going to clean it with alcohol pad, you're going to take the cap off, because again, this one doesn't have it, but we'll pretend it does, and you're going to hold it there for 10 seconds. After 10 seconds, you're going to take it off, you're going to throw it in the sharps container, you're going to massage it in a circular motion, put a band-aid, and reassess the patient. Sharps container, document everything. Okay. Questions? Good. Okay. Next, what's next one? 12B. So kind of again, should have been a review, or should be a review. V1. Now, when it comes to this, try and do your best to put it in order as far as your fingers, and you'll see what I mean right now. Even I'm gonna have a hard time kind of leaving everything together. So the biggest thing here is make sure anatomically you guys say the right location, okay? Don't just say to the right or to the left, stuff like that. I want to hear V1 goes to the right of the sternum, fourth intercostal space. V2 goes fourth intercostal left of the sternum, fourth intercostal space. We're going to skip V3 and go to V4. V4 goes to the fifth intercostal space, mid-clavicular line. Okay, and we follow my clavicle, it should be just underneath the nipple. And for females, we're going to go ahead and lift the breast with the back of our gloved hand. Okay, lift it, put the V4, and then remove your hand. We're going to go ahead and skip V5 and go to V6. V6 is the fifth intercostal space, mid-axillary line. Okay, so follow your armpit straight down. And then we're going to go ahead and plug in V3 in between V2 and V4. And we're going to go ahead and plug in V5 in between V4 and V6. So those are your 6 leads. And then we're going to go ahead and put the limb leads, which is white on right, okay, green on the bottom right, black on top left, and red on bottom left. Okay, so however you want to memorize it, snow over trees or clouds over grass and smoke over fire. Okay, now when it comes to that, don't only say it, point to where you would put it. Okay, if you just sit there and say smoke over fire, snow over trees, okay, it doesn't really tell me that you know where it's at. Okay, you need to point as you're saying it. Okay. Questions? Yes.
So on that, if you just said smoke over fire and you pointed smoke over fire, would that be more okay?
In the right area, like if you say over here, you know,
No,
smoke over fire, then
But if you pointed to the right area,
to the right, of course. What's this next? I had it. Like the actual pole.
Well, I'm pretty tall. You could use my shoulder.
Alright. Thank you.
I gotta use
You gotta use them? Oh. Now be careful when you guys are doing this skill. This one has a cap on so the water comes out. This is why the clip is there. Okay, so just be careful with that. Don't get yourself wet. Don't get the carpet wet. Yeah, that way nobody falls or anything like that. So, again, DSI is in safety. Okay. Remember, this is all sterile, so make sure it doesn't touch the ground or anything like that. Okay, so we're gonna start. Medic's gonna tell you what size, and once you get the right size, again, you're gonna check it, make sure it's not expired, make sure it's clear. If it needs to be clear, there's no floaties or anything like that. The right solution and all that stuff. Make sure everything checks out. When it comes to medication, make sure you check always expiration date, clarity, medication-wise, stuff like that. You want to make sure everything checks out before you start administering anything or assisting with medication. Okay. Once you do that, you're gonna go ahead and ask the medic if it's macro or micro. Remember, that's just the size of it, and whatever they tell you. Okay, we'll say it's macro. Then you're gonna go ahead and make sure, okay, the line is closed. You'll know it's closed because you'll feel the resistance. Okay. Usually when you're clamping away from the actual IV, it's closed, and where you're facing or you're rolling upwards, it's usually open. Okay. So IV's up here, and you open it by going up. Okay. Going down, you close it. So for now, we want to make sure it's closed. We're gonna go ahead and remove the cap. This usually the spike will have a little cap, and we're gonna go ahead and spike, okay, the bag. Once we do that, we're gonna turn it right side up. And we're gonna fill the drip chamber. Okay, this is called a drip chamber. We're gonna fill about halfway. Once you do that, we're gonna make sure it's up. I don't know what happened to my. You guys remember the little hanger that I have? Okay, I don't know if I'm handy right now. And then once we do that, we're gonna go ahead and open up. Open up the line to release any air bubble that may be here. Okay, you gotta make sure you follow the very last one and make sure all the air bubbles out. Okay, once the air bubble is out, we're gonna go ahead and set it at TKO. Who remembers what TKO is? To keep open. So again, it doesn't mean all the way open. It doesn't mean all the way closed. It's about halfway. So it's just a little drip rate. Okay, and then we're gonna go ahead and set it to the medic. Give it to the medic. Okay, how are we gonna give it to him or her? Okay. Just like that. And tell them it's already TKO. It's good to go. You know, like that, and they're gonna grab it and put it right into the patient's leg. Okay, that's it. Good. Questions? No? Okay. What's next? That's it? Alright. Alright, guys, so this is where, again, I'm going to give you guys options. Okay? Okay. I'm going to give you guys options. We obviously didn't make it to the lunch, like I wanted to. So, we're going to go ahead. I'm gonna give you guys an option. Either A, we can just go ahead and do the skills and then go to lunch, which will probably like around 1. You guys still get an hour lunch and everything. I'm not gonna take that away from you or anything. Or you can go to lunch and then right when you guys come back, we can do the skills.
Lunch.
Okay. So you guys thought about it. Okay. So show of hands. Who wants to just do the skills right now and then go to lunch at 1?